All right, we're going to go ahead, and I'm going to go ahead and call the meeting to order. As we go forward, please turn your cell phones to the vibrate and silent and off setting for the Opioid Abatement Advisory Board allows any person to speak regarding any item on the agenda. The speaker is limited to 2 minutes unless otherwise determined by the chairperson to allow sufficient time for all speakers. Speakers shall refrain from abusive, profane remarks, disruptive outward protest, and other conduct which interferes with the orderly conduct of the meeting. Upon completion of the public comment period, discussion is limited to the board members and questions raised by the board. So if you'll please stand and join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Was the meeting properly advertised?
Madam Chair, this meeting was advertised in the Pensacola News Journal on February the 12th in the board's weekly meeting schedule.
Great, thank you. Has everyone had an opportunity to review the minutes for the meeting? Okay, do I have a motion to accept them or approve the minutes?
Madam Finger, so moved.
Have a second? Yes. Thank you. At this time, we will allow public speakers. Do we have anyone signed up for public speaking? No. Okay. Well, then we're going to move right into item number 6 on the agenda, which is the opioid budget review.
All right, we were able to pull in some more funds for the opioid abatement. So far to date, we've received $7,146,139.55. Of that, we have actually obligated or awarded $5,422,221.29.
Great. Next, are there any questions before I move forward? Next, we have the reports for the 24-25 funding availability awardees, community health. Does somebody want to come forward and give an update? Oh, okay. EMS core program.
Things are still going extremely well. To date, we have transitioned 585 patients out of the 668 that we've encountered. We still maintain an 88% success rate with only 46 relapses, which is still hugely incredible. For 2024, we had 1,249 appointments. For 25, we went up to 2,860. We had a 44% increase year over year, and 2026 is going to be just as robust. From our last reward, we've worked on our purchasing of the mobile clinic. We've got the proposals from ETR working with our fleet management. We are about to finalize that purchase by the end of the week, and then it should be anywhere between 90 to 6 months, give or take, I guess, is based on supply chain. But that's where we're at.
Thank you.
Thank you.
Community health, you want to give your update?
Sure. Walter Arrington, Community Health, Northwest Florida. I've got a map for you today. I think it's going to come up on the screens. So we took the time at Community Health. We took our core data, and the map I'm showing you right now, I'm going to zoom out. You can see it's Escambia and Santa Rosa County broken out by zip codes, with the icons being our locations. And it's a heat map of where all of our core patients live. And so you can see, between, looks like 56 and 70 of our core patients live. I believe that's the 05 zip code. Of course, corresponding over here, I believe this is the 06. I think this is the 07. it's just showing kind of the distribution in the community of everybody being served, of course, all the way up to the north end of the county. And then come January when we split off and are also operating Santa Rosa, it also represents that. One thing that's kind of cool, if I can zoom out some more, well, come over. Core patients that were inducted in Escambia County started, got a job, moved to East Crestview, moved all the way over here to Chipley, and still drive back and forth for care within the core program. There's some other stuff within this map that you can look at, seeing our uninsured rates, just different stuff. But it really paints a picture. The uninsured rates follows a 6-year trend or 5-year trend. So you can see the shifts of uninsured through the county. And you can access this if you go to our main landing page at Community Health and then just /Warrington. It'll pop up. But we're going to continue to update this both with core information and any other relevant information from our uniform data system. So,
Thank you.
thank you.
Any questions? Thank you for the update. Ministry Village.
Thank you, Drayton Smith with Ministry Village. You guys have seen the latest rendition, so a lot of changes had to happen there with getting that building properly set on the property boundary lines and with the holding pond and that type of stuff. So we are finalizing all of that. Hopefully within the next couple of weeks, we'll be completely done and able to move forward with pulling permits by the next month, I hope. So still
That's
on
awesome.
target. Everything else is on target.
It looks good.
Yes, thank you.
Thank you.
All right, any questions?
Waterfront Rescue Mission.
We actually probably should remove them because I think they're 100% complete. So
Complete.
we'll remove them from the next
Okay,
one.
thank you. Lakeview, Opus. We caught you at the
Parking time.
walk-in time, didn't we?
Lord, I had to walk a block. Good afternoon, everybody. Our report for January of this year, excuse me, the Opus team distributed 67 boxes of Narcan, 53 packets of fentanyl test strips, 6 wound care management kits, and conducted 8 rapid hepatitis C tests and 11 rapid HIV tests. All of the distributions were made, of course, through street outreach. And for education sessions, they had a total of 12 and 81 contacts for just general street and community outreach for that month. And 2 referrals to substance use treatment, 1 referral to support group, and they've added 1 additional outreach site where they found a lot of homeless in camp. They're kind of spreading around now because every time they break up a camp, they move to, a couple move here, a couple move there, so they're kind of recongealing again, if that's a word. But that's it for us for January.
Thank you.
Thank you.
Next, we have Lakeview Cat.
Hi, Patty Hyde for Lakeview Cat and AIM team. We're settling in. We're fully staffed now with our 3 staff and running groups every week, seeing clients in home, doing some family therapy a little bit, doing like conflict resolution between parents and children. And that's where we're at.
Thank you.
Any questions? Thank you.
Thank you. Next, we'll move to the update on the 25-26 funding availability awardees. Oh, go ahead.
Our EMS partner, can I get you back up here real quick? I have one question. You said that there's a 44% increase from last year, and you're seeing kind of the same trend this year, is that right?
Correct.
Where do you think we're missing the boat on this if we're having such an increase, or do you even know?
Well, in truth, there's a lot of different rationale. As we see the amount of Narcan use within the community and our overdoses being transported reduce, those patients have to go somewhere. And so in the past, there wasn't always as easy to access care. I think it's more of a positive spin for the way the community is moving than a negative. It's more that people feel more comfortable or feel like it's now time. I think it's the fact that we all as a community are focusing both on both sides of the equation, that this is exactly where we want this to move. We want people to, we don't want to focus so much on now that everybody is overdosed. Well, now we're finding a pathway to remedy that, to give these people back their lives. So I think this is more not a negative, it's a positive. You welcome.
Just to piggyback on that for Matt, do we have overall numbers for either one of us? Are we going up, we going down in the community?
We're going up.
Up as in more increased overdoses or less?
We're seeing less overdoses within our program.
You know what I'm saying? Like, is our community, are we headed in the right direction? Like,
No,
we're bringing
we're
it
headed in the
down?
right direction. We're seeing higher enrollment. So we're seeing higher enrollment. You know, unfortunately, we did experience our first program overdose and relapse and death, but
It actually wasn't.
it wasn't? Okay.
No, it was from a pre-existing medical condition.
Okay, so we didn't then. That's a good thing. I gotta change my data.
Yeah, you can say that. We're
I
still
don't have
good.
access
We're
to the
still good.
coroner's reports.
So we're getting more of our people to join for, but as a community, are we seeing less individuals with the addiction problem? I mean, I'm not sure how to word that.
So we're not seeing as many people actively. We left our District 1 meeting today from the EMS and hospitals. We all meet every month. And in this case, we all mentioned about the way that most of our facilities and ourselves, we're seeing a complete reduction in the amount of overdose calls that we're receiving. And the ones that we do are not necessarily opioid-based. We see more meth, and anytime Narcan's being used, it's because tainted what they thought was meth was not meth. So that's really what we're kind of seeing. But if you were to poll most of the EMS agencies, we are using significantly less Narcan, like to the point where we have an abundance, which is, I have never been able to say that, ever. So that's positive news. I think as a community, we still need to work on several fronts. We've made a lot of progress, but we still need more access to care. We need more MAT providers. We need more buy-in from our hospitals and our community that using medication to help get off of drugs, it doesn't make you trade one addiction for the other. And that's something that we all face as we go out and educate the community and these conversations happen. But I think the more that we continue to talk and the more we continue to educate, the better off our whole community is going to continue being.
How's it working with the hospital? Pretty fluid, or?
So there's, yeah. So, do I need a phone call? No. So really, the hospitals, they're good partners. The problem is not necessarily from the administration level. The problem is a provider level. And as we get newer educated providers, they're being trained in the emergency room settings how to do these inductions. And so to that extent, that's positive. When we get patients admitted and you have an older hospitalist who may not be so familiar or comfortable, that takes a little bit more work. That's where we utilize our DCF partners, where they have physician-to-physician peers who then we're working with them to go in and do in-services at the different hospitals to then break down further stigma. But it's all part of, this is a growing pain for the community, but it's a better problem to have than what we were talking about, 6 to 12 months ago. You're welcome.
Thank you. Next, we're going into the 25-26 funding availability awardees updates.
So for fiscal year 25-26, we awarded an additional 9 community partners. You have Brightbridge, EMS Corps, Health and Hope, Hope Above Fear, Lakeview, AIM, Ministry Village at Olive, Offensive, REAP, and the YMCA. All of those contracts have been created, legal has signed off, the community partners have signed off, and they will go before the Board of County Commissioners tomorrow. Once the chairwoman signs the contracts, they then get processed through the clerk's office, which usually takes 3 to 4, sometimes 5 days. And then once those are executed, we'll have a startup meeting with each one of the entities to talk about reimbursement requests, reporting requirements, all of that. So I would say sometime in March, they should get the green light to go.
Okay. Are there any new items, new business items?
Just a new member.
Yes. We'd like to welcome Shell Rodriguez as our new board member. Welcome aboard. If there are not any other items, we need to select another date for our next meeting, or our next meeting is rather already selected, April the 6th. Forget about that. All right. Any other items or anything to discuss? It's pretty quick. Okay, well, the meeting is adjourned.